everyone. I'm the community health advocate at Vibrant Valley Medical Home. I'm going to have an interview about global health issues, which are very recent in these days. So let's start with hearing about the first question. So, as you have understood, we are going to see what is global health. Global health is an area of study, research, and practice that places a priority on improving health and achieving equity in healthcare in different people worldwide. So, as its name says, it's global health. It focuses on health of different people in different countries worldwide, and especially it focuses on health equity in those different nations. So when you're talking about global health, it is important to see what are the countries which are struggling and what are the countries which are performing well, to make sure those countries are in equity and they are helping each other to reach global health equity worldwide. So let's see the next question on global health. So as I understood, we are going to say difference between communicable and non-communicable diseases. According to Alameda Public Health Department, communicable disease is one that is spread from one person to another in different ways. These ways they are contact with blood fluids. Uh, in this communicable disease, people are likely to get this disease when they are in contact with the person with the disease, or when they are frequently accessing the places with the communicable disease. Non-communicable diseases are these diseases that is not transmitted from one person to another, and they are more likely to be those chronic diseases which last a long period of time, like lung cancer and heart diseases. So non-communicable disease cannot be transmitted directly from one person to another, and communicable diseases are transmitted from one person to another. Let's look at the next question. Also, uh, the next question is about Ebola. Ebola is a hemorrhagic fever, which is a deadly disease caused by an infection with one of Ebola virus species. So this is an infectious disease, and it's a communicable disease because it can be transmitted from one person to another, and mostly it is transmitted when a person is in contact with blood or blood fluid of a person who is sick from Ebola, objects that that person have uses, and different animal primates, or when a person sleep with a man who have recovered from Ebola, that person is likely to get Ebola. So Ebola is an infectious disease, and it is transmitted from one person to another. So let's look at the next question. So the fourth question about what would raise a person risk to get Ebola. As we have seen, Ebola is transmitted from one person to another, and the risk to get Ebola is increased when a person go to a place where there is Ebola cases, when a person hunts wild animals, because it is also a virus which lives in primates, when healthcare provider are treating Ebola patients, and when a person is having sex with someone who has recovered from Ebola. Those are the four risk factors areas when a person can get Ebola, when he or she is frequently going to those places or meeting those people. Let's see the next question. So Ebola is a problem worldwide in different countries. So let's see the prevention ways to prevent Ebola disease. Firstly, people should practice hygiene. They should avoid going to different places where there is Ebola cases. They should having materials to prevent Ebola, like soap, water, and everything. of those hygiene materials. They should know how to handle materials of a person who had Ebola disease, like avoiding using those materials. Again, they should avoid going to funerals of people who died from Ebola. And lastly, after coming from a place which had Ebola cases, the person needs to seek medical care directly to see that he he or she didn't get Ebola disease from those places. So let's move to the sixth question. So when people hear about Ebola or other infectious diseases, people have different myths and facts, but people take those ideas differently. So here we are going to say difference between myth and fact uh, about specifically Ebola disease. Educating people about facts and myths will help people to stop Ebola because they will be knowing what are the places where they can get Ebola and avoid having that assumptions in their mind which can prevent them to have measures to prevent Ebola. So having facts to know what are the numbers of people dying from Ebola, what are the risk factors, what are ways to prevent Ebola will be a good strategy to prevent Ebola because people will know what are the measures they can take. So people should avoid myths and the assumption about Ebola disease to know how they can prevent the disease. So here there are some complications that Ebola raises on the rights of travelers. So in an epidemic disease case like Ebola, travelers meet different complications with the authority where they can say people are not traveling from this country to this country. So as an individual, someone has time for departure, has time to travel. So when there's a case of Ebola in a certain country, different travelers, educators, researchers can be prevented to attend uh, their meetings, to attend their programs because of Ebola cases. So the measures from the government may be different from the individual expectation, but till at the end, the person needs to obey the measures that the government have set because it's really helpful to prevent Ebola to be contagious in many places. Therefore, balancing the individual rights and the government responsibility is a very hard situation sometimes, but both the authorities and the individuals need to balance what are the good ways to prevent Ebola, but also without preventing researchers, business people to do their business. So let's see the eighth question of our interview. So smoking and tobacco use is also a big challenge as Ebola is. And here we are going to see what is smoking, what does it do to our health. Smoking causes many diseases and reduces health of smokers. Smoking harms almost every organ of the body. So when people are taking tobacco, it can lead to cancer like lung cancer, heart diseases. It is really an issue to pregnant women because it can cause birth complication. So you can understand as Ebola is an infectious disease and a burden to the world health. Also, we have other non-communicable diseases caused by smoking, and smoking should also be prevented or taken measures to, as Ebola is. So let's see the ninth question of our interview. So I have seen that smokers are affected by the tobacco use, but also there's what we call secondhand smoke. Secondhand smoke is called also involuntary smoking, which is come from inhaling the smoke exhaled by the smokers. So there's the person who is smoking, but there's a neighbor or the person next that person. So that neighbor or that traveler with that smoker or tobacco user need can also inhale that gas or that smoking that person is exhaling. So this also is a bad thing to the world, and it affects people's health, because it can also lead to complication, and even at higher risk than the primary smokers, because it also leads to lung cancer, heart attacks, and strokes. And this is a very dangerous uh, case as the primary smokers. So second-hand smoking is also an issue and need to be stopped than the primary smoking, because it's dangerous to the people who are not really consuming tobacco. So let's move to our last question of our interview. So there are different like there are different use of tobacco, and people don't think tobacco as a drug like cocaine or heroin. So tobacco is also a serious issue, and it leads to addiction, and it creates a strong addiction to tobacco users because of a substance it contains called nicotine. So tobacco also can lead to addiction, and it is very bad as other drugs because of nicotine contained in tobacco, and that nicotine affects the brain, where tobacco users wants to consume tobacco every time that they need that nicotine in their body. So to end up using tobacco very much, there are different medicine that they use that contain a small amount of nicotine, which prevent the tobacco users to continue taking tobacco. So tobacco also is a serious drug that people should stop taking as other drugs like cocaine and heroin. I think this interview was helpful to see what are the communicable and non-communicable diseases and how we can prevent them, and what are the diseases that they lead to, and how we can achieve global health equity worldwide. So thank you very much. Hope you will be using this interview to know how to prevent and how to achieve global health equity worldwide.